We was discussing about the class second drug. Class second drug कौन सा आता है आपका beta blockers. Class second drug is nothing but the beta blockers. Okay, beta adrenergic blockers. Now beta 1 receptor, you know that it is present in the heart. Okay, myocardium of your heart. Beta 1 receptor. So stimulation of this beta 1 receptor by agonists like noradrenaline and all that. So causes the increase in the atomicity of heart. Stimulation of beta 1 receptor in the heart causes the increase in the atomicity of heart and AV conduction and shortens the refractive period. And therefore, beta blockers, if they are used, they will decrease the atomicity, they will decrease the AV conduction, they will increase the refractory period. And that's why beta blockers are used. The beta block result in the beta block blockage of beta receptor result in the decrease in the activation of ASN node and ectopy, which result prolong refractiveness of AV node and slow down the ventricular rate. They also have membrane stabilizing effect in addition to beta blocker, for example, propranolol and oxypranolol. These two have membrane stabilizing effect in addition to beta blockage. Means they will also block some sodium channels. Now individual drug L-propranolol. L isomer is active. It antagonizes the tachyarrhythmia produced by sympathetic discharge because of the increased sympathetic outflow. So whatever tachyarrhythmia, increased heart rate that is produced, it is blocked by L-propranolol, and also decreases the tachyarrhythmia in case of exercise, emotion, anesthesia, induced tachyarrhythmia, and also decreases the tachyarrhythmia induced by thyrotoxicosis, increase the thyroid level. Another drug is known as esmolol. It is a cardioselective beta blocker and has very short duration of action. It is preferred over propranolol and mainly used in the arrhythmia associated with the anesthesia. Now again sotalol. So it is a non-cardioselective beta blocker with additional class 3 property. Class 3 क्या है? Class 3 is nothing but the potassium channel blocker. Okay. So sotalol is having beta blocking activity as well as potassium channel blocker. So non-cardioselective blocker prolongs the monophasic action potential at atria ventricle, prolongs the effective refractory period, prominent class 3 action, prolongation of repolarization by blocking the potassium channel, and it has an adverse effect like torsade defense. Now next class is nothing but the okay. You can see over here the actions of beta blocker. They diminishes or they causes stoppage of phase 4 repolarization. They reduces the atomicity of sinoatrial node. They reduces the heart rate, therefore reduces the heart rate and therefore reduces the AV conduction. Therefore delays the AV conduction. And okay, benefits are due to its anti-arrhythmic, anti-cardiac arrhythmia activity. So it is a beta blockers. Now next class is nothing but the other drugs. Other drugs are nothing but the first one is ibutilide. Ibutilide is a class third drug. Class third is nothing but the potassium channel blocker. Okay, class third is the potassium channel blocker. Yeah, the classification. So try to recall the classification. Class 3 is the potassium channel blocker. Prolong the atrial and ventricular refractory period. It is used in the atrial flutter and fibrillation. Dofetilide is similar drug with the ibutilide and can be used orally. Ibutilide is a only anti-arrhythmic drug. Remember, it is the only anti-arrhythmic drug currently approved by FDA for acute conversion of atrial fibrillation into sinus rhythm. So ibutilide is a only antiarrhythmic drug currently approved by FDA for acute conversion of atrial fibrillation into normal sinus rhythm. Then next one is a potassium. So reduction in the conduction velocity. पोटेशियम जब देंगे आप तो पोटेशियम क्या करेगा? रिडक्शन इन द कंडक्शन वेलोसिटी, prolongation of refractory period and reduction in the atomicity. These are the effect of potassium without causing hypokalemia. Next drug is amiodarone. Amiodarone is known as a wide spectrum anti-arrhythmic drug. Remember, amiodarone is known as a wide spectrum anti-arrhythmic drug. Now it acts by different mechanism. ये सोडियम चैनल को ब्लॉक करेगा, पोटेशियम चैनल को ब्लॉक करेगा, बीटा ब्लॉकर है, इसको एक्टिविटी कैल्शियम चैनल ब्लॉकिंग करेगा. So each and every activity is there with this amiodarone. So remember, sodium channel block, potassium channel block, okay, calcium channel block, beta block is alpha block, depresses the sinus and atrial nodal, prolongs the effective refractory period. सभी ड्रग वही करते हैं. Period of AV node and ventricles also slow down. conduction velocity across the AV node also slow down. It has a wide spectrum of adverse effect, ज़्यादा adverse effect है. Anorexia, nausea, abdominal pain, tremors, hallucination, peripheral neuropathy, एचजीपीटी इलेवेशन मतलब ब्लड में एचजीपीटी का लेवल बढ़ा देगा. हाइपरटेंशन, एवी ब्लॉक, हाइपरसेंसिटिविटी, pneumonitis, pulmonary fibrosis is the major one. It will also affect the asymptomatic corneal deposit. It is an embryotoxic and can it amiodarone has iodine in the structure and that's why it can cause hyperthyroidism. It is a potent drug but more toxic and useful in the treatment of both supraventricular and ventricular tachycardia. It is the longest acting anti-arrhythmic drug, amiodarone. याद रखो इसके बारे में क्वेश्चन आ सकता है. Now, mechanism of action of this amiodarone. So it is a potassium channel block. It will block the potassium ion channel and it will prevent the leakage of potassium ion channel. So effective refractory, it will prolong the phase 4 of repolarization. Also, it increases the effective refract. It increases the action potential duration and refractive period of cardiac action potential. It also prevent the sodium entry. Means it is sodium channel blocker, potassium channel blocker. Okay. It also has a non-specific beta blocker. So it is a beta blocker, potassium channel blocker, sodium channel blocker. It increases the QT interval as there is in case of action potential duration. As it increases the action potential duration, it increases the QT interval and refractory period. So it is a mechanism of action of your amiodarone. Amiodarone is a broad spectrum anti-arrhythmic drug. Next one is a verapamil. Now it is a calcium channel blocker, class 4 drug. Class 4 drug is known as a calcium channel blocker. So verapamil is a calcium channel blocker. It is a drug of choice for rapid conversion of arterial flutter into arterial sinus rhythm. Arterial flutter and arterial fibrillation into sinus rhythm. So verapamil is a calcium channel blocker drug of choice for the rapid conversion of atrial flutter and atrial fibrillation into sinus rhythm. Okay, it can okay in case of paroxysmal supraventricular tachycardia. It is used in the again this condition. It is absolutely contraindicated with the patient on beta blocker, quinidine disopyramide. It is a drug of choice. Remember, drug of choice in the treatment of supraventricular tachycardia. It is a drug of choice for supraventricular tachycardia and for the prophylaxis of paroxysmal supraventricular tachycardia. Next one is a class 6 drug. Okay, class naturally occurring adenosine. Adenosine is nothing but the naturally occurring purine nucleotide. Normally, this purine nucleotide is released in the myocardium, in the myocardial ischemia. अगर myocardium को ऑक्सीजन का सप्लाई कम हो गया या फिर ब्लड सप्लाई कम हो गया तो ये एडेनोसिन वहाँ रिलीज होता है. Now this is naturally occurring purine nucleotide which is released during myocardial ischemia and it has a potent vasodilator properties. Okay, it acts by potassium channel opening. So it is a potassium channel opener and also block the inward calcium channel block. Suppresses the AV node, SA node, nodal conduction. It is used to rapidly terminate the paroxysmal supraventricular tachycardia. It is safe than verapamil. Remember, it is a very short duration of action. इसके ऊपर क्वेश्चन आ चुका है 2 बार तो याद रखो यहाँ पे. Adenosine is a drug of choice paroxysmal supraventricular tachycardia. It is a drug of choice in the treatment of paroxysmal supraventricular tachycardia. GPAT 2021, 20, GPAT 2020, 21, 18 में भी आया था. So adenosine is a naturally occurring nucleoside which is released normally in case of cerebral ischemia. It is a potassium channel opener, calcium channel blocker, used a drug of choice for the treatment of paroxysmal supraventricular tachycardia, and it has the shortest duration of action. It is the shortest acting anti-arrhythmic drug. Longest acting कौन है? Amiodarone is the longest acting. Short acting कौन है? Adenosine is shortest acting. Drug of choice in the paroxysmal supraventricular tachycardia. Now another drug is known as Varnacalant. Varnacalant is a multi-channel blocker. Calcium, sodium, potassium, कौन से भी channel वो block करेगा. Indicated in the conversion of atrial fibrillation into sinus. Sinus का मतलब normal. Beryllium tosylate. Beryllium tosylate is a drug known as adrenergic neuron blocker. Adrenergic neuron blocker. So adrenergic overflow अगर ज़्यादा हो गया तो आपको heart rate बढ़ाएगा. Adrenergic neuron blocker also appears to have a direct action on myocardium and mainly used to treat the ventricular tachycardia and ventricular fibrillation. This is beryllium tosylate. Now, drug used in the treatment of heart block, they are nothing but the isoprene and your dopamine. So you can see the mechanism action of your calcium channel blocker. Calcium channel will blocker will block calcium channel and will decrease the phase, decrease the slope of your slanting the upstroke of action potential in atrioventricular node that causes the increase in the duration of refractory period in the action atrioventricular node, slow down the conduction velocity in atrioventricular node, and abolition of re-entry type of. Now you can see over here the mechanism of action of your adrenergic neuron blockers. They will prolong the refractive period, slow down the conduction velocity at the atrioventricular node, and is possible for the anti-arrhythmic action. So this is example of your Wolff-Parkinson White syndrome. Wolff-Parkinson White syndrome. तो Wolff-Parkinson White syndrome जो पेशेंट को है उसका जो हार्ट है उसमें कंडक्शन जो है कंडक्शन ऑफ इम्पल्स जनरेशन कंडक्शन ऑफ इम्पल्स, तो उसमें क्या होता है कि उसमें बहुत प्रॉब्लम होता है कि नॉर्मली क्या होता है नॉर्मली देखो यहाँ पे एस नोड है आपका एस नोड विल जनरेट द इम्पल्स एंड विल ट्रांसमिट द इम्पल्स टू AV node and simultaneously transmit the impulse to atrium. So atrium will contract and drain their blood into ventricle, and after this, in this impulse reaches to this septum, ventricles will be contracted. In the Wolff-Parkinson syndrome, Wolff-Parkinson syndrome में क्या होता है एक कंडक्शन जो है वो abnormal होता है. So instead of going to left ventricle, ये कंडक्शन फिर से एट्रियम में भी आता है, ठीक है, एट्रियम में भी आता है. That is known as a Wolff-Parkinson syndrome, Wolff-Parkinson White syndrome, conduction abnormality. So that is a genetic disease of conduction abnormality of heart.